joined by Janna Finley, who is with Confluence Health, obviously. You've got the shirt on. This is the first time we've had a falls prevention event. It is National Falls Prevention Week, and so we picked the right week to be out here to talk to folks about preventing falls. We've got a lot of folks representing multiple organizations here, including some of our SAIL instructors. Stay Active and Independent for Life is an important program to improve balance, and along with our Tai Chi instructor, who's also here with us today. But Janna, just tell us a little bit more about the organizations you're involved with, with the balance and all of those aspects of what we're here for today.
Sure. Well, thanks, Dave, for having us out to the Wenatchee Valley Senior Activity Center today. So today is a senior health fair where we're promoting all information related to fall prevention. So I do work for Confluence Health. I'm the hospital's trauma program manager, and the top reason people have injuries and they come see us is due to falls. So it's really about getting the information out there to help prevent falls and keep you in your home as long as possible. So we've got some great folks out here today. So we have physical therapy, occupational therapy, pharmacy, exercise programs. So lots of great information at the activity center today for you. Thanks for having us out today.
And thank you, Janna. I know that Erin Cass had a lot to do with organizing this, but she told me you're the one that made it happen. So thank you very much for all your help.
It was definitely a team effort, and the folks who are here today actually represent our North Central Falls Coalition. So we have lots of different community members here today to represent. So it's fantastic work by everybody.
Erin, many of you in the community know Erin from, the SAIL program, Wellness Place, and all the things she's done in our community. But I think it's great that she's the one that created this idea to have this event today. And she's now involved in another form of support to the community called AmeriCorps. Mm-hmm. And we just picked up an AmeriCorps member here at the Senior Center who will be with us for the next 10 months.
Yes.
Her name is Hannah Walls. And we really appreciate the fact that Erin helped identify this young lady and that we were able to interview her and select her. So, Erin, just tell us a little more about what's going on with AmeriCorps in our community. I think a lot of folks aren't even sure what AmeriCorps is.
AmeriCorps is a national service agency or organization. It's much like the Peace Corps. I call it like a domestic Peace Corps. But I actually served as an AmeriCorps Vista back in 1998, which really led me into the nonprofit sector. So I'm really grateful that Hannah's with you, and it's working out. We have other nonprofit organizations that either have an AmeriCorps member in their site or we're recruiting for members. So AmeriCorps is a great opportunity for anyone age 18 and up, and there's really no age limit. And we have some great opportunities. Our Valley, Our Future is looking for an AmeriCorps member. There's a lot of benefits, this monthly stipend. There's an educational award that one can use to either pay for college, trade school, or even pay off loans. Professional development. There's so many benefits, and you're working as a cohort with other members. So the museum is looking for a member, the school district, Together for Youth. There's some really good opportunities, and so I welcome anyone to call me if they have any questions.
Well, they don't have to be a young person necessarily. I know that you've got some folks that in the community that have been doing a lot of good work that are seniors.
Yes.
And so that's kind of interesting. I will say that we chose a young person because at the Senior Center we think it would be a great endeavor to build a couple programs that we could call intergenerational, so that we've got young people working with seniors.
Yes.
A young lady right out of high school like Hannah, who has a grandmother located here in the Valley.
Right.
And that might get us started with some good ideas as to what to offer to bring seniors and the young people in our community together.
Yep.
So what are your thoughts on some of that?
Oh, I think it's fabulous. I think it's great. I think, there's a common myth that the older subset and the younger subset, they don't have anything in common. But I think that's a fallacy. I think there's so many things in common that, especially when you spend time together, you can really learn that you have more in common than not. So intergenerational programming is key. I think it's a smart move. I think Hannah will do a great job of bringing those opportunities together. And yeah, I could see that happening even with lunch buddies, maybe some high school or college age kids having lunch here.
I have to say that today's a Tuesday,
Yes.
and I'm looking up at the bingo boards, and
yeah.
we're going to have to welcome the bingo players here in about another hour or so. The reason I mention bingo is we're seeing a lot of grandparents coming with their grandchildren to play bingo at the senior center.
Yeah, why not?
And so, and Hannah actually made an attempt to get her grandmother down here the first day or first weeks that she was here.
That's great.
It didn't quite work yet, but we're working on that too. So
Yeah.
I just thought I should mention that there's a lot of different programs where we can get, and I always think of grandparents and grandchildren, but hey, if we could just bring young people and older people together, it would be great.
Yeah, and AmeriCorps Seniors is housed with Chelan Douglas Community Action Council. So we have the AmeriCorps program that we just spoke of, and AmeriCorps Seniors is the Retired Senior Volunteer Program, RSVP, which we're all familiar with. And I work with Karen Bregman with that program. So there's always outlets and ways that people can get involved in our community, whether you're an AmeriCorps or RSVP volunteer. Thanks to our volunteers that are hardworking in our community. They're sale instructors. They work with the Green Bag program with food delivery and pickup. The Packing Friendship program. Gosh, they do a lot in our community. So we're really indebted and grateful.
The most interesting thing that I heard in talking to Erin about AmeriCorps and her participation in the program was she mentioned 1998, but you didn't tell anybody where you were located. Right here at the Senior Center. So that's why there's some deep roots with Erin Cass in the Senior Center, is it goes back to 1998 when you were an AmeriCorps member.
In Suite B or A? Which one was it?
I think it was in Suite B, and that's where the RSVP program was located.
Yeah, and that program was all about intergenerational programming. We placed adult senior tutors with elementary age children, like in Waterville and Antioch and Wenatchee. So I've always had a heart for intergenerational programming, so I'm grateful that you're bringing it back, and it's going to be thriving.
Almost 25 years later.
Oh, come on.
All right. Oh, let's not talk about time.
Yeah.
Okay, thank you, Erin, for
Thank you,
spending the
Dave.
time and helping organize this event.
Thank you.
Enjoying the company of a lot of folks in our community that are concerned about the aging population and being susceptible to falling and how we might be able to prevent that. And Captain Clarke, he's well familiar with some of this stuff because I think you've made a lot of house calls.
We've made a tremendous amount of house calls. Earlier data I collected, which shows that we run on about 6,000 fall calls a year in the Wenatchee Valley, and that's just that run through the 911 center at Rivercom. I asked the local ambulance companies about how many times they go on fall calls, and they looked at me and laughed and said 6,000? No, way more than that. And a lot of the ones that we go on, people end up having traumatic brain injuries and broken hips. And a lot of this is preventable. So that's why we're sharing tips and information on how we can prevent some of these falls and keep the other people safe.
Well, as I say, the way I look at it anyway is our population is getting older and living longer. I guess that's why they're getting older. But mobility is always an issue. And we see it right here at the Senior Center with regard to people, even with walkers, are having trouble, with falling. And so we are very aware of it. And an event like this, where we have representatives from Confluence Health and other care providers, we think will help people be more aware and then maybe take advantage of some of the classes that we have here, the SAIL program, the Tai Chi program, all of which help with balance. And so, Captain Clarke, I just appreciate you coming out today to talk to the folks, and maybe they'll benefit from you being here.
Oh, thanks so much for having me. It's very important. I really hope people take home some good tips and make their home safer.
So we're with Ballard Ambulance. I got Colton here that is well familiar with working with seniors and doing wellness checks that they provide for the community. Thought I might ask him some of the other aspects of falls that we may not be aware of. Tell us a little more about how you're involved with the community in regards to people falling.
So we go on a lot of falls as far as calls go, and some of the most common ones are just getting out of bed or moving around in the bathroom. And there's a lot of easy ways to prevent that. what we see a lot is people just sitting up too fast, and you sit up too fast and you get a little dizzy, or you're moving around a little too quick and you don't plan your route out very well. Little hazards on the ground, cords, cats, clothes on the ground, all tripping hazards. We see a lot. And the vast majority of falls we go to are pretty preventable in nature. And also keeping an eye on your medication. If you change your medication and you get new blood pressure meds, we see a lot of people fall in the first few days after starting those. Just keeping an eye out on all the new stuff you've got going on and trying to plan your path a little bit helps a lot.
One of the things that I've heard about a lot over the years is dehydration. Seniors don't drink enough water.
Yeah.
You want to address that real quick?
Yeah, that plays a part in sitting up and getting dizzy. If you don't have enough fluid in your system, your blood pressure is going to drop a little bit when you sit up, and that can cause what we call a syncopal episode. So you can just black out for a second and you'll fall right over and not know what happened. So definitely making sure to drink water and keeping fluids in your system is very important.
The water thing is stuck on my mind because so many of the falls that we see here, seniors do get dizzy, and
especially with the heat we've been having.
Yeah.
All right, so we're going to hook you up to a monitor here. And this one's going to read your blood pressure. And then we've got another thing we're going to throw on your finger. And that's going to tell us your heart rate and how much oxygen's in your blood.
Okay.
That's going to go on like that. And I'm going to borrow your pointer finger on this side. Perfect. And we'll see here, your oxygen's going to show up in this box here, and then your heart rate's in the top. So you're looking pretty good. Your oxygen's at 97 right now, which is just about perfect. Your heart rate's at 64, which is lower than mine. Looking good, and then it's going to grab your blood pressure here in a second.
I have to remember, did I take my blood pressure medication last night or not?
I guess we'll find out.
If I didn't, it'll be high, right? No, that's high.
It's not too bad. You're not setting any records today, I'll tell you that.
Well, we won't repeat the numbers. Hopefully nobody will see it. But I'm going to survive the day. Okay.
Sounds good.
Okay, Jeske represents the pharmacy, Confluence, and is here today with us to talk to our seniors about what kind of special services you can offer.
We give them a few education pointer about their medication just to make sure they are aware. As they get older, their medication dose might need to be adjusted because medication are dosed sometimes based on liver function and the kidney function. So they want to make sure they see their doctor every year to get the lab drawn. As we get older too, we might experience more side effects from medication, such as sedation, low blood pressure, or imbalance problem. If that happens, we can make sure that we adjust the dose of the medication, or we can switch them to a different medication so that they won't have an increased risk of falling. And also, we give them just a few common pointer, like don't take someone else's medication, because there might be interaction with other medication that they're currently taking. Sometimes people will cut up their pills so that they have a longer day supply, but that will decrease the dose that they're taking, so that won't be so effective. So we give them some common pointer like that. Sometimes people will take medication that expire. It won't harm them per se, but it will decrease the effectiveness of the medications if they are expired. So we want to make sure they are aware of that, don't take expired medications. Just a few pointers, to educate the community about what to do.
So what would be the advantage of a senior using your pharmacy versus one of the other pharmacies in our community? Is there an advantage?
Well, actually, we don't have a community pharmacy. We have one at CWH. But that pharmacy is specifically for patients who are under the compassionate care program, patients who cannot afford their medications, or for patients who are currently hospitalized at the hospital, and they need to get their medication on discharge. The pharmacy that you see at Wenatchee Valley Hospital is a community pharmacy, but they are an independent entity. They're actually not owned by Confluence Health, so we don't actually have a community pharmacies, But that one does offer compounding, which you can't really get from, say, Safeway or Fred Meyer. So if you need something custom, something compound, like a cream or a liquid, they're good for that. That's a service that they offer that you can't really get from any other retail pharmacy.
Okay. Well, thanks for explaining that. I've always been kind of curious about how that setup works. We have more representatives from Confluence here, and we're going to talk a little rehab. So introduce yourself and tell us a little more about what you folks do over there.
Sure. My name is Angie Jeske. I am the manager of Wenatchee Valley Hospital Inpatient Rehab. We have a 9-bed acute care inpatient rehab. So what that means is the patient population that we see are patients that do need hospitalization, they have medical issues going on, and they also need therapy at the same time. So they're able to get 3 hours of therapy with us a day while they're in the hospital and kind of help their bodies reacclimate to the new normal that they're going through, and then figure out what it is that they'll need to go home or go to another facility to keep them safe.
And typically, how long would a stay be with you?
Yeah, it really depends on the diagnosis, but about 7 to 10 days is our typical. Yeah, and so right here we have the diagnoses that we see. We are stroke certified, so that is our highest population of patients that we see. And so we get those patients probably 3 to 5 days after their initial stroke, straight from like the step down ICU. And then they come to us and start working really hard with therapies and hopefully get a lot of that mobility back.
I want to thank Mobile Meals of Wenatchee coming out today. And, it's important that our community be aware of what they can offer the seniors, and give us some of the specifics that they need to be aware of to join up with the Mobile Meals.
So Mobile Meals offers a hot, fresh meal Monday through Friday in the East Wenatchee Greater area, the Wenatchee City area. We offer meals to those that might have come out of surgery, might be recovering from an illness, they might be on hospice. They may just not be able to fully care for themselves. So they can have that meal delivered hot and fresh to their door each day.
I know a lot of people get a little bit mixed up in words. This is the Mobile Meals of Wenatchee. It's not Meals on Wheels.
Yes.
And we don't have Meals on Wheels in our community. But it's a really good service. How many years have your organization been providing meals to seniors?
Yeah, so Mobile Meals started in 1971. So it'll be 51 years this November, I believe, if I remember correctly. Yeah. Yes. We are confused a lot with Meals on Wheels. If somebody does live in the outlying area, I always give them Meals on Wheels' phone number.
So it is an option for people in the outlying areas, yeah.
Yes. We contract with Confluence Health. Central Washington Hospital prepares the meals for us each day. So we do ask for $5.50 a meal. If someone cannot afford all of that, we do require a $2 minimum payment per meal. Always fun to come out in the public and try to spread the word. So Thank you for the wonderful facility.
Okay. Thank you, Trish. Okay.
Thank you.
Right. We're with SHIBA, and SHIBA is a well-known acronym, I think, throughout the Valley. They help advise people on their Medicare supplements, and are you going to be able to come back out here during the day when we're serving lunch and advise people?
Definitely. So we would work on a day where we can have our SHIBA advisors come down and advise folks on their Medicare coverage options. Open enrollment begins October 15th and it runs through December 7th. So that is that 8-week window to make changes to your Medicare.
You've been doing this for a while. You've been organizing all the volunteers. I know you've been scrambling to find additional volunteers. How's all that going?
We're still working on it. Yes. So if you would like to volunteer, just send them my way.
So they're looking for volunteers to advise people on their Medicare supplements primarily, right?
Medicare supplemental, Medicare Advantage, Medicare prescription drug coverage, all of it.
So they're sanctioned by the state insurance commissioner. So, there's a lot of work that goes on behind the scenes to train people, and so they can provide objective information about different plans that are available. But I've already been asked by numerous seniors, when are they coming back? I got questions about my Medicare. So it's nice to know. We'll arrange for a date hopefully every week, same day of the week kind of a thing, lunchtime.
Great.
Okay.
We will be here.
Anything else you want to tell us about what's going on with SHIBA?
No, they can just give us a call during that time frame to make changes to their Medicare coverage, and they can call us at 888-452-0731.
Thank you, Yuriko.
Thank you.
So I'm with Diane Tribble, who represents Aging and Adult Care that covers, 5 counties, 6 counties? And located in East Wenatchee. Obviously, the Senior Center works really close with them. And today we thought we'd talk a little bit about what they can provide seniors if they do fall, right?
Right.
And there's a little device that if they talk to you nicely, maybe, they can acquire one of those devices. So Diane, why don't you explain how that works?
Okay, so we have a program that for people who are at risk of falling, that provides for a personal emergency response button. And those are the systems that if you fall or are having an illness and you need some help, that you can push that little alarm and summon emergency help. Yeah, and what they usually do is the companies will call, if you've named a responder, like a family member, they'll call the family member first, and if the family member doesn't answer, then they call 911, they call the emergency services, and they can help you come to your home and help you up if that's what you need, or transport you to the hospital if that's necessary. Yeah, and then we have programs too, basically to help people to stay healthy at home as they age in place. So that's home care services that usually if a person has some help at home, they're less likely to fall. Yeah.
Well, that's the objective is, keeping people at home longer in independent living.
Right.
And we're all trying to work towards that goal. Exercise has a lot to do with it. I know we're able to offer a lot of exercise opportunities that help prevent falling. And, I just think that the community is really joined together to help the seniors with all this. And education's a big part of it, and that's why we're here today. So hopefully you've been talking to a lot of our seniors, and they're coming away with some good information about how to prevent their falls.
Yeah, I think so. Yeah, it's been a really great time.
I'm with Kevin McBride. McBride, right?
Yeah.
See, I remembered your last name. I'm doing pretty good. Or is it on the thing? Okay.
It's somewhere in here, but I know you know it.
We also call Kevin the Cookie Man because he used to come to our lunches once a month and talk to the folks about hearing aids and going to Costco and getting their needs met. And I see nobody has taken advantage. Well, there's a few missing, but not very many. I might have to grab. Oh, that's a fresh one. Okay. But tell us what's going on with Costco and the hearing aid program that you've got. Anything you might have for seniors?
Well, we offer the top of the line products and less than half the price of other places. You got 180 days to try them out. If you don't like them, you bring them back. And Costco's always generous in that regard, just being able to get the best hearing possible out to the public. So.
Well, I know as you wander around Costco, you see the little rooms back there where you actually do the testing on site, right?
We do. Yeah.
And so I know that almost all the folks that come there to get hearing aids are seniors. Is there any special programs, anything unique that you do versus the competition?
Well, we offer real ear measurements and stuff. That's a probe tube that we use to measure at the eardrum what sounds are doing, how the hearing aids are actually performing. That's one thing that competitors don't typically offer. It's a product that really helps in aiding and programming of the instruments, so we do a better job.
All right. So we have some representatives here with Confluence Health that I guess it's a part of the organization, Pallative Care.
Pallative Care, yes.
And she wants to talk about advanced planning. So introduce yourself and tell us more about it.
So I'm Alison Keeler, and I'm a nurse with Confluence Health, and I'm here representing advanced care planning, really talking about giving directives to your families and your loved ones on what you'd like for the future of your medical care. Confluence Health holds a workshop 2 times a month, and the phone number to call if you're interested is 509-436-4008. and they can get you signed up for attending one of the free workshops. There's no pressure, it's information, and if you'd like to fill out your advance directives at that time, you certainly can with support from some of the nurses and a social worker from the palliative care team.
My name's John Springer. I'm a physical therapist with Home Health and rehab supervisor. So Home Health is an entity that allows us to come into people's homes and treat them, people who are homebound. We provide skilled nursing, physical therapy, occupational therapy, speech therapy, social work, and bath aids to those individuals that aren't able to get out to receive those rehab services.
Well, if they need more information about your services, how do they reach you?
They can get a hold of us at 509-433 3700. Thank you.
You're welcome.
Thanks for taking the time to join us
bet.
today.
Thank you.
Great service. So the Y has been a long-standing organization in our community, offering a lot of services and services to seniors that, I'd say most of the exercise that was done back in the day was at the Y. Of course, now there's a lot of opportunities. But just tell us a little more of what special programs you can offer the seniors.
So at the Y, we do offer group exercise classes specifically geared towards seniors to help with balance and grip strength to help prevent falls, as well as offering our own group exercise classes. We do partner with the Matter of Balance group as well as the Ease Cancer Foundation to help target those specific groups to help as many people as we can. And then cost is always a question. So typically seniors will have a $53 membership, or most of the time their insurance company will cover it as well. So it just depends on what route they want to go through. I think that's about it.
Okay.
I think, yeah.
I see Selena around town quite a bit, promoting Link and talking to folks about some of the changes that have gone on here recently post-COVID. And so Selena, tell us one about all the special services you can provide seniors, but also on some of the changes that have happened recently.
So Link Transit, of course, is the public transportation provider for 3,500 square miles of rural Washington state. We are challenged, like everyone else right now, in being able to have enough coach operators to provide the level of service that most of our riders are used to. So be on the lookout if you are a Link Transit rider for our new schedule book. It comes out October 3rd, and there are a few changes, and they do require some cutbacks in our service because we do not have enough coach operators to continue the level of service that we were operating before. So you can pick up one of these. You can also pick up one of these, which is a summary of the changes that you will see in the new book. So we will be scaling up service as soon as we're able to meet the hiring demands.
So the Link Plus has been a big favorite here at the Senior Center. Obviously, seniors can come from their home directly to the Senior Center, have lunch, and then you come back and pick them up. Is there going to be any real changes to the Link Plus program?
The Link Plus program will stay the way it is. So if you're already on the Link Plus program, you should not have to worry about any change to your service.
And how can they get signed up for Link Plus and have their questions answered? Who would they reach out to?
They would call Link Transit at 509-662-1155. That phone number is on the back of every single vehicle that Link Transit owns. It's on the back of our schedule book. It's hard to miss that phone number. So please reach out to us if you need a door-to-door service, and we have an application form for you to fill out, and we will interview you. And once you get signed up, you will have that door-to-door service available to you.
We're with the commonly seen name Lifeline, right? And ambulances, but you provide a lot of other services, and I wasn't aware of some of that. So why don't you let us know a little bit more about what some of these other services are beyond just the ambulance service that you provide to the community?
Sure. It's a great question, and thanks for asking. We provide, the technical term is non-emergent medical transport, but we like to kind of just call it cabulance or home to care and back, So what that allows is for maybe a return trip from the hospital, maybe a hospital stay, maybe just an ER visit, and you're able to get back to your place where you live, but you don't need an ambulance to get there. It can be something like that to something maybe more routine, like even just picking up prescriptions, going to a family reunion, or maybe you need a specialist appointment, that's in Seattle or Spokane, or from the north down to the south. We've even taken some patients out of the state if necessary. As long as they don't need to be in an ambulance, then they can ride in the comfort of either a wheelchair that we can provide, or they can use their own, or just in the back of our van.
So as a part of our event today, we have Osteo Strong. I know they've been around for several years now in our community, and we see them out here at the Senior Center quite often, but this is a special event for falls prevention, and obviously they fit right into it, and you're going to understand why when she starts telling us about what Osteo Strong can do for seniors.
Wonderful. Hi, I'm Brittany with Osteo Strong, your local musculoskeletal strengthening center. We're here today at the Fall Prevention Day just to do balance assessments for people and give people a number as to what their risk for falling is. When you come into our center, we have 4 different pieces of equipment that we help to set people up in the strongest, safest position, and with that, they're improving their bone density, they're improving their posture, their balance, helping to just improve overall strength. It takes about 15 minutes once a week to come in and use our system. We have everything from whole body vibration to the balance tracker for balance assessments, PEMF mats for recovery services, some Normatec compression therapy, and really cool Tyant water, which is ionized alkaline water as well.
So how do they contact you for more information, and where are you located?
So if people want to come in, the first session is completely complimentary. You can call us at 509-293-7451. We're located in the Harley Center between the UPS store and Little Caesars Pizza by the new Chicken Shack.
And how long have you been in the community now?
We're just getting ready to celebrate our 4-year anniversary of being open. So the month of October, we've got some really great specials coming out for people to try things at a complimentary cost just to give back to the community.
Well, over the past several years, I've become well familiar with how important it is to have the proper bone density, to do all the things, exercise, diet, all of those things come together. But as we age, we're susceptible to falling and breaking a limb, and this is where these folks come in.
Absolutely. We've had a number of people do balance assessments today that have been part of the SAIL classes that you guys offer here, and you can see a difference with the people who are taking the SAIL classes and the people who aren't. So keep doing what you're doing. That's awesome.